In Week 7, we examined trauma-informed and mental health-aligned practices as essential components of special education. Within an academically rigorous framework, these practices are not supplemental. They are foundational to equitable instruction, student well-being, and long-term educational access. The central question is not whether trauma affects learning, but how educators can design environments that reduce harm and restore the conditions necessary for engagement, regulation, and growth. Trauma-informed teaching begins with an understanding that exposure to chronic stress, violence, loss, displacement, or neglect can alter attention, memory, executive functioning, and emotional control. In special education, this requires educators to interpret behavior. A student's withdrawal, agitation, or resistance may reflect survival responses rather than willful defiance. Emotional safety and school climate are central to this work. Students learn best in environments where routines are stable, language is respectful, and cultural identity is affirmed. Visual supports, calm transitions, consistent feedback, and opportunities for student voice contribute to a sense of control and belonging. School climate is not an abstract concept. It is experienced in every interaction, transition, and response to distress. When educators intentionally reduce uncertainty and increase trust, they improve access to curriculum and participation in the school community. Collaboration with mental health professionals extends the teacher's capacity to respond appropriately and ethically. Special educators, counselors, psychologists, social workers, and families must work as an integrated team, sharing observations, coordinating interventions, and aligning supports across settings. This collaboration should be guided by confidentiality, role clarity, and evidence-based decision-making. When school personnel communicate effectively, they can distinguish between instructional needs, behavioral support needs, and clinical concerns, ensuring that students receive the right level of support at the right time. Trauma-informed practices include proactive strategies such as check-ins, choice-making, sensory regulation supports, restorative conversations, and explicit instruction in coping and self-advocacy. They also require reflective practice by educators who must examine bias, avoid re-traumatization, and sustain high expectations without a punitive over-reliance on exclusionary discipline. In this model, trauma-informed education is both compassionate and rigorous. It protects emotional safety while preserving academic challenge. Ultimately, trauma-informed and mental health-aligned practices advance the mission of special education by linking access, equity, and whole child development. They remind us that effective teaching is not only about content delivery, but about creating conditions in which every learner can feel safe, supported, and capable of success.